And with that, I'm going to have Colleen come on and just talk a little bit about some of the work happening in Pennsylvania, and then we'll wrap up our day with a video.
Thanks so much, Michelle, and I will keep this brief. I wish we could be in person so much to high five each other for all the good work that's going on, and people I haven't seen in a long time. Folks from Green and Healthy Homes, Len Merritt from Rochester, Amanda at the National Center for Healthy Homes. These are folks that are my go-to people to advance work being done in Pennsylvania. So you have participated in this great, well-organized summit today. Thank you to Lead Safe Allegheny, to Women for a Healthy Environment, and all of the organizers. And at the end of the day right now, maybe you're asking yourself, well, now what? What's the next step? Maybe you've been working on lead poisoning prevention for 10, 20, 30 years, and maybe it's just been 2 or 3 months. No matter how long you've been doing it, you'd be very welcome to answer your now what question by joining the Pennsylvania Lead-Free Promise Project. You would be joining other people across the Commonwealth who are committed to preventing the very next baby from being injured by lead. So I'm Colleen McCauley. I'm from Children First. We're a kids advocacy group in the Southeast, and I also staff the Lead-Free Promise Project. All right, so what the heck is the Lead-Free Promise Project? Well, we're focused on 3 goals. Number 1, to get the state to create a pot of money for financially hardship homeowners to get lead out of their properties. Number 2, to get all kids screened at ages 1 and 2. And number 3, to automatically refer children with elevated blood lead levels to early intervention to be assessed to whether or not they need those services or other services. And your input and insight are critical to making those positive changes. Okay, so who's involved in the Lead-Free Promise Project? 45 organizations are officially supporting the project. And these include, for example, Women for a Healthy Environment, the Westmoreland Community Action, Allies for Children, all out there in the West. But we also have health plans such as Gateway and Health Partners, and the City of Lancaster, and the Erie Redevelopment Authority, and Bata Environmental, and the Pennsylvania Chiefs of Police Association. There are also individuals, private citizens, parents. They don't represent a particular organization, but they want to make positive change happen, and they are participating. All are welcome. Okay, so how can you get involved, right? So we're organized into 2 main groups. One is really focused on changing policies and laws to get lead paint hazards out of houses so kids never get poisoned in the first place. And that's the public engagement group. The second group is focused on getting more kids screened and tested for lead, and that's the screening group. And so you can get involved a little or you could get involved a lot depending on your interest and time. So for example, with a little time, you could have a brief phone call with one of the Lead-Free Promise Project co-chairs and share your ideas. If you're a parent or a caregiver or healthcare provider and you've got a story to share about a child who's been harmed by lead, we could do a brief phone call to listen to your experience and consider asking you to share that experience in a letter to the editor of your local paper or in a letter to your legislator to educate people. We've heard that loud and clear today. If you've got more time, you can participate in one of these monthly subgroup meetings. They're virtual. You can join from the comfort of wherever you are. You can join coalition members who are meeting with our local legislators to educate them and make recommendations about how policies need to be changed. So everyone's welcome to be involved. I also lastly want to say that the Lead-Free Promise Project has put out some really terrific resources for folks who participated today. So if you work for a health center or primary care office, we have a resource guide to help manage the care of children with elevated blood lead levels. Hey, do you want to know if your county is among the top 20 that have the highest number of poisoned children? Check out the fact sheets on the website. And if you'd like to get involved, you can contact me and we'll throw a bunch of stuff in the chat for how you can get connected. Thanks so much.
Colleen, thank you so much for being here and for sharing the Lead-Free Promise Project with everyone. So as everyone has heard, In Pennsylvania, there are so many rich opportunities to become engaged. Joining the Lead Free Promise Project is one. If you're in Western Pennsylvania, joining Lead Safe Allegheny Coalition is another. We will be sharing again these slides and presentation today so that you'll have all of these resources at your fingertips to be able to put together strategies for how to address lead poisoning prevention in your own backyard, in your communities. So I just wanted to, I'm checking my clock and it's been running all day. So we're at 8 hours, 43 minutes, and 12 seconds. You all are rock stars for hanging in there with us the entire day. It has been an amazing day full of information that I think all of us will take. I know I've learned so much today. I'm inspired by the hard work and dedication of all of you, of all of the panelists who came to share their knowledge and insights with us. We have 2 more sessions this evening: how physicians and healthcare providers play a role in lead poisoning prevention, as well as a renter's right to a lead-safe environment. They're both critical conversations, and I hope that you'll be able to join either of those, and information will be shared in the chat about that. But now, to close out our day, I have the distinct honor and pleasure of announcing the Herbert L. Needleman, MD, Lead Champion Award. This award is being named and given posthumously to Dr. Needleman, a Pittsburgh pediatrician, researcher, and advocate for lead poisoning awareness and action. Dr. Needleman was instrumental in both identifying the impacts of lead on cognitive development at low dose exposure, as well as the disproportionate impact that lead exposure has in children and in communities of color. That was over 50 years ago. And here we are today, still advocating for equitable primary prevention strategies to be enacted at the local, the state, and the federal levels of government. Data continues to inform us today that in 2021, lead impacts children in Black and Brown communities at an alarming rate. Dr. Needleman pushed for stronger regulations to lower the action level for elevated blood levels. How coincidental, yet ironic today that we have the CDC announcement. He knew that consistent and low levels of lead exposure had devastating health impacts. This physician spoke openly, honestly, and quite frankly, forcefully about the need to eliminate lead from gasoline, paint, and consumer products such as toys. And like the tobacco and chemical manufacturers of today, industry fought to dismiss Dr. Needleman's work. This was a public relations nightmare for their agenda, and they had to move swiftly to counter Dr. Needleman's research. But Dr. Needleman persevered. Taking his fight to Congress, he knew that there was no other path forward. Dr. Needleman was a force of nature. He founded the Alliance to End Childhood Lead Poisoning, which later became known as the Alliance for Healthy Homes, and it has since merged with the National Center for Healthy Housing. Dr. Needleman knew that we had to make homes lead safe. He advocated passionately for remediation programs across the country. Dr. Needleman was a brilliant, sensitive, caring, and generous man. I had the distinct pleasure of meeting him, albeit briefly, when he served on the board of an organization that I had worked for many years ago. Today, we are and continue to be so very grateful to Dr. Needleman and his family. His legacy will live on, and we will make certain that everyone knows the story of Dr. Needleman and how a lead champion changed the world to make it a better place. So that's why this award is so significant. Excuse me. I'm honored to present today, and now would like to introduce you to Dr. Herb Needleman's son, Dr. Joshua Needleman.
Hello, my name is Joshua Needleman, and on the behalf of Herbert Needleman's family, I want to express our appreciation and gratitude for the way your group is honoring his memory and, more importantly, for the excellent and important work that you are doing. My father first became aware of the pervasive problem of lead in children's health as a young physician in the mid-1950s. When treating a young girl who was lead poisoned, he informed her mother that the source of the toxin was lead paint and dust in her home. To keep her daughter safe, he counseled, they would have to move. The mother responded, "Where am I supposed to go? Any home I can afford will be no different than the one I am in now." My father always described that moment as the time that he awoke to the breadth and depth of the problem, one that would require solutions at the scientific, medical, public health, and community levels. As he spent the next 50 years documenting the impact of small doses of lead on children's health and development, he also advocated for the public policy and legislative innovations that were required to eliminate lead as a hazard for children. And while much progress is made in the quest to end lead as a threat to children, there is much work to be done. That is why I know that he'd be very gratified to see the work that you have done and are doing to eliminate lead as a hazard in his hometown. Whenever my father was honored for his accomplishments, he always took the opportunity to turn the spotlight away from himself and onto the problem of the environment and children's health. Therefore, on behalf of his family, I applaud your work and wish you continued success. Thank you.
Oh, thank you to Dr. Joshua Needleman. So great to be able to have him to join us here virtually via video. Dr. Needleman's son Joshua is in New York City, and so he was kind enough to present that video for us that we could share with all of you today. And I know that they are honored that we are able to recognize Dr. Needleman, his dad, in this space. So from here on, we would like to continue to honor Dr. Needleman's legacy through the presentation of this award at each of the Lead Safe Allegheny Coalition's annual meetings. Over the next 8 months, we will form a committee to develop selection criteria and a nomination process for the future Dr. Herbert L. Needleman Lead Champion Award. This award will be an ongoing opportunity to celebrate our progress and recognize the many champions working to build an equitable, healthy, and lead-safe Allegheny. So with that, I find it fitting that we'll be closing our day just a little bit after 5. We tried real hard to stay on track, but we really appreciate all of you being with us throughout the day to hear about starting off this morning with hearing a little bit more about environmental racism. You know, I was thinking about and taking some notes that we heard from Latricia this morning about environmental racism is an inequitable distribution of environmental hazards based on race. We have to do better. Our environmental justice panel told us that. They gave us some ideas, they gave us some strategies and solutions. Let's take those and let's mobilize and put them into action. We heard about humanizing the work. Picture the individuals being impacted and let that move you. Let it move you. I think we heard that from Latricia, who is referencing the great John Lewis. We heard a lot that data is key, how we can use data as a resource for us to put our actions into communities and how we can think about systems change. That was just an interwoven theme that continued to rise through each section, whether it was the county level discussion about policy or the local level. And so what does that mean? That means with systems changes, we're looking at root causes. That means that we have an intentional process that we're going to proceed with. It means that we're going to break down these artificial boundaries that exist and that we are going to be effective agents of change. I know that you will be an agent of change. I promise to be one as well. Together we'll make a difference. So with that, let's close out our day. Just remember to come back and join with one of the panels this evening. It's a pleasure to have you all with us, and let's continue the conversation tomorrow. Happy National Lead Poisoning Prevention Week, and let's continue on not only this week, but all of the weeks to come. Take care, and thank you for being with us.